all of us are very well aware that there are some settings in which we've seen absolutely no increase in outcome for our patients. And whereas we've talked before about our solid tumour colleagues saying, oh, we've made no advances in pancreatic cancer, for instance, we've made virtually no advances in the treatment of AML for the elderly. Even though we have made huge advances in CLL, it's only a matter of time before we're going to see patients come through resistant to agents like ibrutinib and venetoclax. So even in those diseases where we're seeing good responses, there are going to be failures. And there are other areas like acute myeloid leukemia in the elderly, acute lymphoblastic leukemia in the elderly, where there's a complete unmet need in understanding and how we can treat these types of patients. I believe the future is led by diseases like CLL, where targeted therapies have clearly led to major advances, and I believe that's going to be the case in other types of leukemias. It's not looking at the moment as if we yet have a one therapy fits all for those diseases, and it's going to be about finding what are the subsets of patients that are going to respond to which available agents, about finding ways to bring those agents together in combination, because I don't believe that many of these diseases will be treated with monotherapy. And I think the charitable sector will have a large part to play in doing this, because for companies, bringing agents together from different companies is not something that historically they've done well. Identifying groups of patients who've got completely unmet need in whom no advances have been made are, again, not areas where they've tended to focus the research. So I think, for me, those are the areas that I'd like to and do see charities like Luca really making big advances.